Hey everyone, welcome back to my channel. It has been a little while since I made my last video. I did a series on my transition to meat-free, which was pretty cool. I'm still meat-free. just do like eggs and fish now, but no more red meat, no more chicken. Kind of miss chicken, but I'm not ready to go back to it. So, yeah, I have some really exciting news. I am actually having a breast reduction. This is like the best thing since sliced bread, basically, for me. I've had a long history of back and shoulder issues that go back probably, oh my gosh, I don't even know, forever. I really started having a lot of back and shoulder, like severe back and shoulder issues, probably about 6 years ago. I actually thought that I tore my right rotator cuff because the pain was just so bad. And it wasn't. So I had some like cortisone injections, and those aren't long term. They would probably last about 6 or 8 weeks, and then I was still starting to have really bad pain again. Um, so this has really been kind of an exciting time, an exciting process. And, I kind of decided to start another series for this just because a lot of the girls that I have been watching on YouTube have been so informational and so helpful in this decision-making process. And, the education that I've learned from a lot of these girls, just different tips and tricks and different things that they experienced that they wish that they would have done differently. All kind of just like a load of just like a wealth of information, that things I would have never even thought of. So I am really excited to share this journey with you. And I actually did find out that I have been approved through insurance for surgery. So it happened extremely quickly. I was not expecting that because a lot of people have said that sometimes it will take up to 4 to 6 weeks, maybe even 8, for the insurance company to get back to you stating if you are or are not eligible for insurance coverage. So I believe my information was sent to the insurance company on like a Thursday or Friday, and I called the following Wednesday to ensure that they received all the information that they needed, to see if they needed me to send anything else. And they're like, no, we've received everything and you're approved. And I was like, what? No, can you check again? Because that was like really fast. And they're like, no, we received it on the 2nd and you were approved on the 4th. And I'm like, oh my gosh, this is really happening. So, yes, this is definitely going to be a process. So just kind of something that I wanted to say, something that no one really on YouTube had told me or like prepared me for. Maybe other people didn't go through this. I don't know like how it works with insurance companies and things like that. I am a nurse, but I'm extremely ignorant when it comes to anything that has to do with insurance. Sorry, that is not my specialty area. So I kind of have to like phone a friend or like ask people about what the situation is because I have no idea. Okay. So when I called the insurance company, they told me that the surgeon's office had sent over two medical codes for the procedure. One of the codes was for reduction mammoplasty, which is your breast reduction surgery, which I was approved for. And the other one, I believe, was like chest reconstruction or breast reconstruction surgery or something along those lines. Don't quote me. I don't know exactly what the code was. And that one was actually denied. So I got off the phone with them and I called the surgeon's office and I, talked to them about it. And I'm like, hey, one of the codes was approved, one was denied. What does this mean? Like, what's the situation? And they said that that's totally normal. They usually send in two codes to see if one will get approved over the other, and it's basically it's okay. It's no big thing. So my code for the reduction was approved, so we are golden to go for surgery. So basically, the final factor, like the final straw in this whole situation that made me really decide to do this was obviously you guys that have tuned into my channel before know I have been on a weight loss journey, and I have been just like eating clean, working out, signed up at a new gym that I love. You know, I've been going to a lot of classes. I actually had to slow down on the classes because I'm in physical therapy now. And I've been having some issues with my back. So I kind of had to slow down on those, and just like kind of focus more on like, how do I say this? Um, not low intensity, but like elliptical treadmill, like not like a lot of high intensity workouts, basically, which kind of sucks for me because I was really, really getting into it and I was really enjoying the classes. But it's only for now. So I've just kind of been focusing lately on elliptical and treadmill on an incline, so I can still obviously keep burning calories, keep moving on with my journey, and I'm still eating clean, no meat, lots of vegetables. Right now, I'm going through this phase where I'm like obsessed with cabbage vegetable soup. I'm like, who am I even? I don't even know, okay? All I wanted to used to eat is tacos and In-N-Out Burger. So here I am. Which In-N-Out Burger, by the way, is across the country from me. So when anybody in LA area, California area travels there, they usually bring them back on the plane for my boyfriend and I. It's that serious, okay? So for me to even think of going meat-free was like a huge step. Anybody that's also tuned in before knows I'm like, think dairy is the devil. So I'm still dairy-free, and now obviously still doing without the meat. So just kind of like, just really honing in and trying to just stay healthy and keep active and, you know, just really focus on getting my body ready and prepared for a healthy outcome with surgery. So, what are some other things I can tell you? Oh yeah, where we were getting with this was the final straw, that, you know, really was like, oh yeah, this is going to happen. I can't take this anymore. I'm done, with these huge boobs, can't do it. I was in a workout class and we're on the floor and we're kind of trying to do this like rotation thing with our arms and weights, and I just felt like I was like suffocating on breasts. I'm trying to be as politically correct here as I can, okay? I felt like I was choking. I just felt like, oh my God, they're up to my chin. I'm trying to work out. I'm just trying to get better at everything in regards to my health. Like this, I can't deal with this anymore. I have been losing inches around my chest, like my under bust, okay, area, whatever, but I'm not losing anything in my actual cup size, which is the most aggravating thing of life when you have back pain and you're hurting and you're uncomfortable and you have to wear two bras to work out or two bras to do your job or whatever. Everyone knows how, all ladies know how it feels to come home and take your bra off and it's like this magical moment, okay? Seriously, it's ridiculous that we even have to deal with this kind of thing. Anyways, so was in my workout class and I'm trying to do this workout and I'm like, I cannot keep doing this. This is ridiculous already. Like, I feel like I'm suffocating on my own body. I'm like, okay, I'm done. So, lucky me. I obviously, you guys, some of you might know this, some of you might not. I do work in surgery. I'm a circulating nurse in the operating room, and I think it's like an amazing job. I do love it. It has its days, obviously. Some are better than others. But I worked a long time to get into surgery, and I just think that the whole process of surgery is just unbelievable. I mean, it's like walking on the moon. It's really crazy that some people can, you know, have this opportunity to do this for a living, and I'm very, very lucky that I have this outlet where I know this great group of people that, you know, help take care of other people. And, you know, it's a very low recognition job, I feel like, because, you know, we're kind of like a behind the scenes crew. But it is very rewarding. And, you know, I have this great, I feel like, benefit that I know a lot of wonderful surgeons and I know a lot of wonderful people that work in the operating room that have a lot of experience in different areas of healthcare. And I mean, I can't say enough about my team. I think that I would never have surgery somewhere else And I did have the opportunity to have my surgery at another facility not far down the street from where I work, just for privacy issues and whatever. Listen, it's not that serious, okay? They're breasts. We've all seen them, especially all of us healthcare workers. It is not, they're just boobs, okay? It's not that serious. I mean, obviously, surgery is serious. This is an intense procedure. The surgery is intense. The healing process is intense. So I'm not downplaying that at all. But I mean, honestly, the last thing I'm worried about is somebody seeing my boobs. Okay? No. Especially, you know, the team of people that I'm going to be with. It's just ridiculous. But some people might be worried about that. I'm not. I'm a nurse. I've been doing this for years. That is the last thing on my mind. Okay? I'm just thinking, get me through anesthesia, wake me up, get me home to my family. Period. The end. Okay? So, basically, you know, once I decided, okay, I'm done, enough, I can't take this anymore, I did go and talk to one of my surgeons, a plastic surgeon that I have talked to about this before a few times. I did want to have this done when I was like 2021, but I was really scared and I like wasn't ready to commit yet. And I was like, oh no, it's too big of a surgery. Can't do this, whatever. Okay, well, here I am. Almost 29. I'll be 29 next month. And I'm like, let's do it. I don't care. I'm over this. Let's go. So, talk to the surgeon. She's like, oh yeah, just set up, you know, an appointment with the office, whatever, we'll get you in. So, I went to the consult. My boyfriend went with me, and it was just pretty amazing, actually. I don't think I, I don't really think I have an idea what I'm in for because I've seen this procedure before, but I don't think I know, like, start to finish what to expect and what I was really in for. So, basically, you know, they tell you kind of like what to expect, like before and after. Like, you know, you want to be on a low sodium diet. You want to, you know, so you're gonna have to be sleeping on your back, which I am a total side and belly sleeper. So having to sleep basically sitting up and on your back is probably going to be a challenge for me. I'm hoping I'll be really exhausted and in pain and just want to sleep and not care what position I'm in. Because, you know, during that healing process, the breasts are mostly adipose tissue. They're mostly fat, right? So if you are, they're kind of like what I think of as kind of like Play-Doh after surgery. So if you're laying on one side, that side is going to, you know, have an impression or, you know, like a groove or a dent kind of. So you want to make sure that you're, you know, staying in your surgical bra, which they'll put on you after surgery. It has some little buttons in the front and like a little zipper. And it just looks like a regular bra, but it just has a front strap instead of, sorry, my computer just like, I don't know, did something weird. So the bra is just like a regular bra, and it just has the zipper and the buttons in front. So you have to stay in that for like, I think no underwire, for like, I think at least a month. The incisions are pretty intense. They want to give it, you know, time to heal. But you know, obviously you can change your sports bra, you know, after however many days, whenever you're comfortable. But I will have some drains and pain pumps, which thank the Lord. So those will kind of be coming out of the sides here. And if I have surgery on a Friday, those will come out on a Monday. So not too bad. Hopefully I will be staying overnight in the hospital one night. My surgeon likes to do 3 doses of post-operative antibiotics, IV, which by all means, whatever works. And she also does IV pain meds as well in the hospital. So hopefully I'll be able to get some good rest my first night post-operatively. And then I'll go home the next day. So surgery on a Friday, go home on a Saturday, and then Monday my drains and pain pumps will come out. So those are kind of the things that we talked about in the consult. And then she took me into this like private like assessment room. And, you know, she has you, you know, obviously take your shirt off and she'll do like an assessment on your breasts. And basically when I took my shirt off, she was like, oh, you need it. You need a reduction. Which obviously I already knew. She's like, they're so heavy. And I'm like, yeah, you think? So, I'm not gonna say her name just yet because I don't have her consent for that at this point. And I was feeling really good today, so I'm like, hey, I'm gonna shoot this video and we're gonna make a series out of this. So I obviously want to ask her first before I put her name out, but she's just an angel and I just think she's awesome. And I'm just so excited, and I just feel really blessed to have this opportunity and to feel comfortable with the surgeon that I'm going to be with. I just think it's so important. So, anyways, so at the appointment, you know, she takes some pictures. They do a front view and two side views, and I think that's a really important aspect of the procedure because you want to see your before and after photos, right? I mean, you want to have something to compare it to. I mean, in my opinion, I would want that. It's just like a neck down photo, so your face won't be exposed. And this is a great way to be able to show people that are coming in for a consult, like, hey, look at these pictures. This is her before and after. Like somebody that kind of has like the same body type as you or the same breast type as you can kind of see, hey, this is what it looks like now. This is what it might look like afterwards. They don't give you like a size range of what you'll be after surgery, which is totally fine. But like everybody has been asking me, hey, have they told you like what are you gonna be? Like a big B, a little C? Like what do you think? And I'm like, I don't know. I'm not sure. They don't do that. Well, at least my surgeon doesn't. Maybe other surgeons do. I'm not sure. I have heard some girls on YouTube that were like really pissed because they went into surgery and they were told they were going to be a B cup and they came out and they were like a D. And they're like, dude, what happened? You know? So I would rather not know, to be honest. My surgeon and I had the conversation. She knows what I want. I told her, hey, take as much as safely possible that will still allow me to be able to breastfeed. That's my goal. So there is this special equation that they do with like your body weight, your body mass index, and they do this equation and it tells you basically what insurance would require you to take. And I think mine was like 700 grams per breast at the minimum. That's what insurance would require. That is 1.5 pounds off of each breast. That is 3 pounds of boob at the minimum. I'm just like, oh my God, this is crazy. You know, 3 pounds doesn't seem like it's that much, but if you hold 3 pounds of meat in your hand for a minute, it's pretty freaking heavy, okay? So slap that on your chest, and yeah, it's pretty uncomfortable to carry that around all damn day and night, you know? So I'm just like, holy cow, this is happening. This is insane. So, what else did we talk about at the consult? You know, she did talk to me about the insurance approval situation, and like I said, I was approved in like 2 days. Oh my gosh, I was just like dumbfounded. So obviously the documentation was done well. You know, my previous documentation of the years of, you know, back issues, shoulder issues. I actually also, a lot of people don't know that this can be, you know, some people think, oh, I have carpal tunnel or I have ulnar nerve syndrome or whatever. Actually, a lot of people don't realize that the nerves in your neck and your upper arms can be compressed from the weight of your breasts, and it can cause numbness and tingling in your fingers, your hands, your arms. And I had that for a long time. And like I said, I'm a horrible patient. I'm getting better, and I'm going to be like really try to be the best patient ever throughout this process. I'm going to do everything I'm told. I've already started doing things that she's told me to be doing. So I'm like, oh, I really hope I'm going to be better at this. But I didn't go and get like EMG tested which is like a nerve muscle test to see if you have carpal tunnel or ulnar what do they call this? Like ulnar nerve syndrome or whatever. I was never tested. I probably should have been, but actually they think that it's stemming from the compression of the nerves in my neck and my upper arms. So usually only when I drive, blow dry my hair, sleep. Um, those are the times that I feel it the most. But it's actually been pretty good lately. I bought some new pillows and I've been trying to like position myself appropriately at night. So I haven't been having as much pain and or tingling and numbness in my arms. So that's cool. Um, what are some other things that we talked about? She just said basically once the insurance approval goes through, then we'll schedule a pre-op visit and we'll schedule surgery. So I actually already had my pre-op blood work drawn last week. So everything came back perfect, thank God. I'm very grateful for that. And for some reason, I'm always like really cautious about like my cholesterol levels and my blood sugars. Like I'm always paranoid because I am overweight, that they're going to be like too high, and I'm just like really, really paranoid about that. But I mean, with how well I've been eating and working out and trying to like really just live as healthy a lifestyle as I can, I was not expecting any issues this time. So everything was perfect. The blood sugar levels and everything were great. Blood levels were great. So not too worried. I was approved last week for surgery. So they're going to call me back, they said probably tomorrow, to schedule my pre-op visit, which will probably hopefully be next week or the week after. We'll schedule surgery and get this show on the road. Some cool things that she did tell me at the consult were, she wants me to start pumping the vitamin C, obviously just so I'm as healthy as possible, before, during, and after surgery. So she wants me taking, I believe, like 1,000 milligrams a day. So I started that already. Just on my own, I did start taking collagen peptides from Vital Proteins. A lot of girls on YouTube talk about this one too, Instagram, social media, which I'm obsessed with. Um, but I actually got the beauty water and strawberry lemon from Vital Proteins, and I can't do it straight. Can't do it just in the water. So I have been making myself a smoothie every day, either for breakfast or lunch, and I've been mixing the collagen peptide powder, the beauty water. That's the same thing. You might hear me say one or the other, but the beauty water, I've been mixing it in with chia seed, almond milk, and then whatever fruit I want with like almond butter. And I love it. So I kind of just mix it in. They do have an unflavored one, and if you want to take a peek at their website, it's vitalproteins.com, I believe. But they have some really cool stuff. Now, I probably next time will probably get the unflavored one just so I can mix it in anything. But some people drink it straight. I'm not a huge fan of just the straight. This maybe I put too much. I don't know. It says 2 scoops per serving, and another thing I like about it is obviously I don't eat red meat anymore or chicken, so obviously it is a peptide. It is a protein. So it's 11 grams of protein per serving, which bumps up that the protein shake that I drink. Excuse me. So that's pretty cool too. So the collagen helps for skin, hair, nails, digestion, and joint health. So I feel like I can't go wrong. So I'm always looking for things, obviously, to make my skin more healthy. So I think that's pretty cool. And then obviously to promote the wound healing after surgery with the skin. So I've already started the collagen. It is one of the building blocks, building block proteins that help, regenerate skin, hair, and nails. So I started that. I will continue that after surgery. And I think that's just an added benefit to just help my skin regenerate and to help my wounds heal. She did say that coconut oil and cocoa butter are like the best things to help with scarring. The incisions are pretty intense. I'm not looking forward to that part. But I feel like I'm just not going to look for a few days. The good news is I'll see the doctor a few days after surgery. She can take it off. She can assess the situation. My boyfriend is a nurse as well, so he'll be home with me he'll be with me at the hospital, and then he'll be home with me through the weekend. So I'm going to let him deal with the drain situation. He can empty the drains, and I'm just not going to look at anything until I see the doctor 2 days later. So I think that's probably the best bet. And then she said, because I wanted to try bio oil. Everybody's like, loves bio oil. My sister used it, I believe, throughout her pregnancy and afterwards for stretch marks. And she looks freaking awesome. So obviously it works. You know, maybe it works better for other people. I'm not really sure. But I was like super stoked to try it. Bought it off Amazon, obviously. And I was like, oh, this is going to be so cool. I love anything that has to do with skincare, okay? #1 fan right here. Skincare all the way. I'm obsessed. So you tell me you like something skincare, chances are I'm probably going to try it, okay? So I'm like, let me get this bio oil. Let me see how it is. And I got it, and I like it, but it's scented. And I was like, oh, no. It's got like lavender and some flowery things going on. And I'm like, oh, yeah, no, not on incisions. I don't think that's a good idea. Some people do it. I don't know. I'm not trying to do it. I feel like it would burn or something. I don't know. I'm not sure. But I have been using it like on my hands, elbows, knees. It's freaking awesome. I mean, I actually really love it. I love the smell. It smells like lavender and lilac to me, and I'm like, oh, all about it. Okay. So I asked her about it, and she's like, you know, I used to tell people Mederma, and a lot of people want to use bio oil, but just use coconut oil and coconut butter, and that's like the best results. And I'm like, okay, we're doing it. So I bought Kopari coconut oil off of Ulta during their like 21 days of beauty, and it's really expensive. I don't know if it's necessary. I don't really know what the difference is between like a beauty coconut oil and a cooking coconut oil. Maybe it's the same. I don't know. They just told me like unrefined coconut oil, organic, blah, blah, blah. So I'm like, okay. So it's really expensive. Don't do it. It's like $28 a jar. Only reason I bought it is because I got it for 50% off on the, you know, the Ulta 21 Days of Beauty. So I did buy a few jars, and gotta say, love it. It smells great, works great, skin feels good. I already started using it because I couldn't hold off. So I like it a lot. Would I buy it for $28 a jar? No, I would not. Okay, that's all I have to say about that. So that's going to kind of be my scarring regimen. I'll kind of show you like kind of how my incisions will be anchor incisions. So the incision will go like around the nipple and then down like a lollipop, and then it will be under both breasts, and it kind of comes a little bit like farther back, like not totally under the armpit, but like kind of close, kind of back. So it's kind of like an anchor, okay? So it's going to be a lollipop around the nipple, down the front of the nipple, and then underneath, like back towards the sides. The incisions are large, okay? There is no way to sugarcoat it. However, I think that the scars definitely outweigh the severity of the back pain and the back issues that I have. It's just ridiculous at this point. And it does become expensive. You know, these back issues have been going on for years, and I'm just done. So I'm not worried about it. I'm not worried about the scarring. It's just a little price to pay for ultimate relief. And I cannot wait. I am over the moon. I'm so excited. So basically, someone should be calling me tomorrow to schedule the pre-op visit, and then we'll get surgery scheduled then. Just kind of waiting to see how things work out with my work schedule. My hair is acting crazy right now. Oh yeah, by the way, it's like April 8th. Okay, it's supposed to be spring right now, and it's like 34 degrees. in Chicagoland right now, and it like snowed 2 days ago. I'm like, can we do spring already? Okay. What made me think of that is I'm like letting my hair do its own thing right now because one day it will rain, and then by Thursday it's supposed to be like 70 degrees. I'm like, okay, so what are we just gonna like hop right from April to like April snow to like summer, 70 degrees in 2 days? I don't know, but I'm not dealing with my hair because I know if it's gonna be 70, this hair is gonna be acting crazy the second I step outside, okay? Anyways, moving on. Just some fun things that I learned from some YouTubers. This community, I mean, wow. There's just like so much information, and these girls that have been making these mini series are phenomenal, and I cannot say enough how grateful I am just to have been able to watch their experiences, and that's ultimately why I really want to do this series. You know, I know some people are like, oh, you're so obsessed with social media, blah, blah, blah. But honestly, like, I have learned a lot, and I'm all about education. I just think the more educated you are, the better your success will be, and I just think that, holy crap, like the amount of info that I've learned is just like, just even the little things that you will like, I would have never thought of some of this stuff. And I'm like, holy crap, this is really cool. Some of the little tips that I have heard are like bring a small pillow in the car with you for on the drive home from the hospital. Um, I do have a small one. I don't have it with me right now. It's downstairs, but I'll show you in another video. It's kind of like a rectangular kind of pillow. It's kind of small-ish, but it's like rectangular, and they tell you to bring it in the car with you to put over your breasts on your way home, so that when you put the seatbelt over you, it's not shearing or rubbing on your surgical bra. Because really, I mean, they're gonna put like some steri strips and maybe some like skin glue, and then or skin glue and then steri strips, whatever, and then they put like some ABD pads, and then they just put like the surgical bra over. So yeah, it is a dressing, but it's not like this big, bulky, huge thing that's going to pad you, and it's really not. So just to have that like extra, comfort of not like rubbing on you in the car while you're driving home. My hospital is at minimum 40-45 minutes from where I live. So that's that. That was one tip. Another tip I heard was, to buy some pajamas that either zip up or button up in the front, because you might have some difficulty with, chicken dance, with lifting your arms for a few days. Might have some bruising there, maybe some swelling, so it might be kind of uncomfortable for a while to lift your arms to go overhead with a bra or with pajamas or whatever. So I did go to Walmart and Target, and I bought myself some granny pajamas, 2-piece, just, t-shirt, button up with pants. That's it. It is nothing sexy, that is for sure. But it's convenient, it's comfortable, and that's that. My mom's trying to get me in a muumuu. I'm not having it. Okay. However, if you have one, you might want to use it because, especially if you're going to be home alone at any point and need help, like using the washroom or whatever, it might be more convenient to just lift something up to sit down and pee instead of having to pull your pants down and sit. I don't know. I have no idea. I know I'm not wearing a muumuu. Okay, so done with that conversation. Some other things that I learned. Told you about the coconut butter already, coconut oil. What else can I tell you? I think she said after surgery also, I already talked about the low sodium diet, I know that. But obviously, you can't have any anti-inflammatory medications for like 2 weeks before surgery and a few days after, which is really difficult for me because I live on ibuprofen right now. So that's going to be an experience. So just kind of those kind of things to keep in mind. You know, we'll talk more about day of surgery stuff once it gets a little bit closer. Um, what else can I tell you? I'm trying to think of some things that I learned from other girls on YouTube as well. Um, it really, I can't say enough how grateful I am to have, a wonderful support team in the hospital and at home. I feel like I have a lot less anxiety because I know the anesthesiologists that I work with, and I know the people that I work with are just, I mean, out of this world. Um, and I couldn't be more grateful to my crew and to my family at home. Um, I am lucky that my boyfriend is a nurse. He knows what's up. He will know how to take care of my drains and dressings, whatever I need. That was another thing that one of the girls on YouTube told me. I think Amazon has like a huge quantity of like abdominal dressings, ABD pads they're called, um, and those you can use to like kind of put like on your incision sites before you put like your surgical bra back on if you want to take like your dressings off and stuff, because they're going to take them off of you when you get your pumps and your drains out, I guess. Or I don't know, some surgeons don't do pain pumps and drains, so it depends on what you're having done. But just to kind of cover your incisions so they're not rubbing on your bra and stuff after you have all that stuff taken off. They have like, I don't remember if it's like 100 or something, and it's only like $10 or $12 for like 100 ABD pads or whatever. You can get those on Amazon. You can get them at Walmart and Target. They're just a little bit more expensive for a less quantity. I did notice that. What else? I think that's it. A lot of girls said, just pack something comfortable to wear at home, to wear on your way from the hospital to the way home. Like if you want to do your button-up pajama shirt or, a zip-up hoodie, something that you're going to be comfortable where it's not too much effort to get it on and off. And then, oh, I know a really good one. And this is something that the surgeon told me at my consultation and that I heard from a lot of YouTubers. Obviously, you want to be as prepared at home as you can for surgery, right? You want to make sure you have everything organized at your convenience. Get your meds filled before surgery. You don't want to be running around on your way home from the hospital when you're in pain and your bra's rubbing and you're like in the car and you're nauseous and you're on pain meds and you're like, get me out of here. Get your prescriptions filled before the day of surgery. Bring a bucket or some kind of device or whatever bag, something that you can use in the car if you're nauseated and you need to throw up. So pillow, bucket in the car for the way home. You might not need it, but you might. There was multiple girls that I've listened to on YouTube that were like so nauseated in the car on the way home. They're like, oh my God, I was dry heaving and blah, 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 and it was just terrible. Just bring a bucket or something. Just have it on, in the car on standby, just in case you need it. You don't want to be in that situation. So just little tips and tricks that I learned so far. This is definitely going to be a journey, but I really wanted to share it with everybody because I'm just so excited. And I know everybody's like, oh my God, Jamie's having a breast reduction, like blah, blah, blah. I'm just like so excited. And I've probably told people that don't even care, whatever, cool. But I'm just like so thrilled. I'm like, yes, let's be done with this back pain. Let's get rid of these. Let me fit into clothes. Like, let me fit into a bathing suit without having to worry about busting out. It's just so many different things that, so many different reasons why I'm looking forward to this, but obviously number one is health and back and spine. So I will probably make a video after my pre-op visit to let you guys know how it went, what's up, when the surgery date is scheduled. And I'm just so grateful to be able to share this with you and share my excitement. And I hope that by doing this, somebody else will benefit from it and learn something or take something away from this. I definitely have taken so much away from all the videos I've watched from the other girls on YouTube, and I'll link some of those girls in the bottom. I cannot say um, how blessed I feel to have this much information. First of all, at my fingertips, and second of all, in my workplace. Um, you know what? It's just such a great platform. And maybe at some point, you know, I can refer people to my surgeon. You know, at some point, maybe you know I'll get permission for that. But right now, I just wanted to let you in on what's happening, and I'm totally into series. I think it's really cool. So I can't wait to let you guys know what's up next, and we'll see how this goes. Hopefully, I'll have a surgical date in the next week or so, because it is getting closer. It's already April 8th, and I'm shooting for surgery like May 11th. So it is slowly approaching, a little bit over a month out. So pretty cool. So I just wanted to let you guys know what was happening, and I look forward to creating this series, and it should be fun. I'm sure I'm going to be in a lot of pain at some point, and I already told my boyfriend I don't care. We still have to shoot no matter what, because I really want people to see what this experience is like, and I hope that everybody gains something from it. And next time we will talk surgery, and what to expect on the day of surgery and after surgery. All right. Hope to see you guys soon.